بسم الله الرحمن الرحيم. أحييكم من مدينة ظباء شمال غرب المملكة. We are going to talk today about laser in dentistry, or the application of laser in modern dentistry. I hope everything will be perfect. This is the first time to use the live with using the Facebook. This is part of the city where I am from now, Doba. You could see different colors here, and different color means different type of wavelength. We know the sun is a source of light, and laser can be part of the visible light. As you could see, the orange color, the blue color, and the red color all mixed together. In the past, one of the Arab scholars, he used to be one of the reference, or the first one who started to study or to write about the basic principles for the modern camera today. And that is Hassan ibn al-Haytham, who was born in Al-Basra and lived in Egypt. Some authors in laser, when they mentioned Al-Hassan or Ibn al-Haytham, they refer him as a Persian, but they ignore that he is from the Middle East or from the Arab region. And today we are going to talk about the application of laser, which is light, in all aspects of dentistry, like in restorative, prosto, or endo, whatever, in hard tissue and in soft tissue as well. And we're going to mention different type of laser application, including the erbium mag laser, and the diode laser, the Indiag laser. We're going to refer to KTB and Holmiag laser as a wavelengths properties, but we are not going to show any clinical application for these wavelengths, except the commonly used wavelength. And I think in the future, I'm expecting we are not going to use the word erbium or diode. We are going to use the wavelength only, the figure. For example, we have diode 890, we have diode 810, we have diode 840. So I'm expecting in the future we are going to use the term diode or NDI. We will refer only to the wavelength for the different type of properties for laser tissue interaction. You need training to use laser. This is my Professor Bradley. I used to do training under his supervision using the CO2 laser. It's a beautiful tool for soft tissue. We know that the light spectrum, it has the visible light, the ultraviolet, and the infrared. The visible light between 400 nanometer to around 700 nanometer, and the below 400 we call it ultraviolet, and those beyond the 700 we call it infrared. And in the infrared we divide it into near infrared, middle infrared, and the far infrared. Most of the lasers we are using, they are in the visible and in the infrared. When you go to the far infrared, the wavelength will increase in the length. Like the CO2 laser, you could say it's almost 10,600 micron compared with the Indiag, which is only 10 1064 nanometer, or you could say 1.06 micron, and the laser CO2 is 10.6 micron. You could see here there are different types of laser here: the Holmiag, the Erbiumag, the Erbium from here also, and the diode. And in the visible, we could see the helium neon, the aiming beam. We can use it as aiming beam just to show you the spot of the laser. And we can use the argon laser in the blue green here. The ruby comes here in the red. The KB comes here in the green side. The alexandrite, which is in the area of the ultraviolet side. The laser is just a normal light, but it is condensed. So we'll talk about this laser. This is different type of laser here mentioned. Laser to react, it has different reaction properties with tissues. So when the wavelength interact with the tissue, we know that the tissue contain water. Some tissues has more stain or pigmentation, like hemoglobin. It has red color. We know that melanin has a dark color. So in oral cavity, we have all this kind of colors. We have to understand that each wavelength has different action with different colors or structures in the oral cavity. So the blue curve here is the red, the blue one. This is the absorption curve for the water, and you can see here the more you go to the far infrared, like the CO2 here, you could the high absorption of tissue or the water with by the CO2 laser. It means that the laser tissue interaction very fast, the cutting very fast. So I could say CO2 is the best tool for cutting in the oral cavity. If you go to the white line here, this is the absorption of the hydroxyapatite. Here we are going to talk about those lasers that can remove caries or can cut in hard tissue, and the best here is the erbium laser. It has a very high absorption. The erbium laser, the wavelength is 2.94 micron. The red here, this is the hemoglobin, as you could see here, and we could see those wavelengths from 8 or 0.8 micron or 800 nanometer, like what we call the diode or the argon in the visible light, highly absorbed by hemoglobin. So in case if I have hemangioma, I will go with the diode because I need to seal the blood vessels. I need to cut with less bleeding. I could cut fast with the CO2. I could cut better coagulation with the diode laser or with the argon laser. Of course, the ENIAC also has a high absorption by the hemoglobin. If you could see here the erbium and cut in soft tissue because it's also highly absorbed by water, but again it has less effect on the coagulation. The melanin, of course, here comes in the region of the diode, the near infrared and the visible light. So we could say that there are different absorption level for laser or different type of laser. So I have to understand which type of laser I'm going to use to deal with a certain part of the oral cavity, like if I'm going to deal with the hard tissue or with a normal soft tissue, with pigmentation, with hemangioma or fibroma, lipoma. So according to the need for the type of procedure, I'm going to select the best wavelength. We have to consider that laser is not like the blade. Both they have the ability to cut, but laser has the ability to change in the underneath structure without changing too much changing in the surface. But the blade, to cut, you have to first start cutting in the superficial layer. I could use the laser as a knife blade or as a light blade, sorry, but I have to keep in mind that I might do changes beyond the surface. So if I am doing a surgery, for example, phrenectomy using diode or Nd:YAG, I have to be very careful about the epidermis, the blood vessels supplying the anterior teeth. I might see them without noticing any changes in front of me. So in this case, I have to be careful in the direction of my light and also the power of my light and the type of wavelength I'm going to use. We could see here, I might seal the blood vessels deep here without too much changes in the surface. So for different type of colors, I have to select different type of laser. This is just generally, I could say, and this is actually this is one of the disadvantages of the laser, that one wavelength is not enough to be used. In medical lasers in my clinic in Riyadh, I have the CO2, I have the Nd:YAG 1.06, I have the Nd:YAG 1.32, I have the RBN, I have the diode 980, I have the diode 18. So I have to prepare or collect too many wavelengths to get the best for my patient. And we know that our oral cavity has different structures. It's not only soft. We have hard, soft. We have big melanin. We have blood vessels. So we have to select the proper type of laser we are going to use. Today, the software for the laser became very easy. The manufacturer make it easy for the laser users or to those interested using laser, and they have a program that you can just select the name of the as I'm going to show, or you can adjust the power, the hertz yourself manually. Well, laser started actually almost in 1960, but being developed, and in 1980s where the contact or we started to use the in dentistry, but in oral cavity in 1972, Professor Strong was using the CO2. He was an ENT surgeon in the oral cavity as a surgical light blade. We can divide laser into three different applications: the health, the high level laser therapy, or the cells, the selective laser therapy, or the low intensity laser therapy, LILT. The health, where we are using mostly in dentistry, also we are using LILT for pain and healing, but the CELT, this for those they are dealing with tumors, so they have to inject the patient with sensitive chemical material and then apply a low-level laser to kill the malignant tumor in the skin, like basal cell squamous cell carcinoma, basal cell carcinoma. Sorry. The low-level laser, as I mentioned, can be for healing and pain. This is the photodynamic therapy, which I mentioned. Let's talk briefly about laser physics, which is very important to know these things. To apply laser, you have to understand how to drive the laser wavelength. I always compare driving a laser wavelength with driving an aeroplane. I mean, anyone can drive the car, but to drive an aeroplane, you have to understand some concepts and equations and special training. For laser, you have to have a background of laser physics so you can apply laser safely for your patient and to get a better result without damaging. So laser is safe light if you apply it safely. It is collimated and it's also one color, monochromaticity, and coherent. So compared with the normal light, the normal light is scattered and too many wavelengths, only one single color, and diverge, while the laser together and one wavelength usually and parallel to each other. The modern machines, they can combine two machines together, but they have two different sources. So two machines can come in together, but sources are different. We call it blended wavelength. I will go into details sorry for the focusing. I'm holding the mobile with my hand. The photons, when similar concepts for I study in physics. When the electron gets energy, it goes up to a higher level, and when it's released, when it's come back to the norm to the original level, it's emit the photons, and the machine setup help in producing this wavelength from one direction, and it is concentrated. And I think we have studied in dentistry, like if you could see here, I mean the arrow, if you pull it very hard, this gives more energy, and here the more wavelength together, two wavelength together, the peak with the peak, we studied in the physics, this give a higher peak, so it gives its enforcement. So that's give the laser the more power. So the more wavelength coming together in a harmony way, this gives more energy in the light. So the difference between normal light and the laser light is intensity. It is more intensified, so it has more energy than normal light. Although it is visible like KTB or argon and the visible light or ruby, but it is more intense. So the reaction with the tissue is different than normal light. This is, if you remember, we've studied this before, two wavelengths coming together. This is from here we measure the wavelength, but the height here can be increased or reinforced if 2 or 3 or 5 wavelengths coming in a harmony together. And this in physics we study also if this is going to cancel each other because they are in opposite position. That's why the term of laser comes from light amplification by stimulated emission of radiation. So there are a source to stimulate the laser to produce to stimulate the atoms to produce the light. We have different sources of laser. We have liquid, solid, and gas. And this is, I don't think it's important to talk about this, but it is very important to know, if you're applying laser, spot size. What is the energy density? How much energy I need to apply for a specific lesion? So, and I have to, of course, to know the parameters covering soft tissue, like retraction, or how fast I should run laser with my hand, and how much power I need to use. Do I need to use 20 watt or 10 watt or 1 watt? And when I can use high power and when I can use a low power. This is really very important, and this is the other things which we should know, like the watts, the power density, joules, and the fluence. And modern laser today, they have the facilities that can produce laser according to the type of treatment you are using, or the specialty in dentistry. We measure energy joules, of course, and the fluence with joule per centimeter square, and the frequency, the hertz. This is the pulse, we call it, which is the number of pulse per second. This is the hertz. How many pulse there is, continuous and pulse. We'll talk about this later. Contact and non-contact. This is also another issue. We can just really mention it very quickly. The laser can come with through a mirror and air, and reflected with one mirror to another, and then comes out here. This lens here, where they come from, like this here. This point, this is the most powerful part of the laser beam, where we have the handpiece here and the spot size is here. We have to understand to know the size of the spot size. Is it 500 micron or 150 micron? Yesterday I have just received a new CO2 machine with only 150 micron spot size. So the amount of energy I'm applying here will be actually important if I'm using 10 watt with a spot size of 500, or I'm going to use 5 watt with spot size of 200. This is the articulate arm, the fiber which commonly used in dentistry, where the laser can be carried with the fiber, and you can get the feel of it. Although I love the actually articulate arm because it's more fast, because like the CO2 and the area laser. In the laser, there are many machines, they don't have light. You can't see the color of the laser, like the diode, I mean, from 800 up to the CO2, there is no light. And there is a problem. How can I see the light? I mean, only when I fire, I could see the reaction of the laser. But for this reason, they solve the problem by putting another small laser here with a red color that it comes through the beam. So just to show you where is the spot, that is not the laser. This is the aiming beam, we call it. But the laser, which most of the machines you don't see it. Continuous pulse, the difference between continuous pulse and the pulse, you can give more in a short period, where in continuous I can give a very low power with a long time, but at the same, at the end I am going to deliver the same amount of energy. The pulse pulse where you fire no laser, then laser, no continuous. And if you compare here, zone here, this is the heat emission on the both sides of the laser. The more time here, the more increase in the thermal zone or the coagulation zone around the target. Here you are getting more damage to the tissue with continuous. With a pulse, you only get the benefit of laser tissue interaction without heat emission. So that's why sometimes we can play with the pulse and we can treat patients without local anesthesia if it's necessary. Well, laser either absorbed or reflected, or it can be scattered down in the tissue, and depends, either you do coagulation or you do vaporization for the tissue. I did a study actually to see the parameters affecting the laser. This is my Professor Bradley. We do cut with a different type of laser. This is in early 1993, I think we started. And then we studied the histology and to see the different reaction. And of course, if you increase power, will increase the thermal effect of the tissue. And also, we found that retraction is very important to reduce the side effect of the coagulation with the laser. You have to retract your tissue very well to reduce the coagulation zone. And also, modern speed is important, and you don't need more than 10 watt in the oral cavity. And we found also cutting in the mucous membrane takes more time than connective tissue. This is the speed and the power I mentioned earlier. And we did also histology in my PhD. We advanced the machine, and we found that doing cutting with CO2 is very fast compared with the other diode or KTB. The diode and the KTB, they are medium coagulative. This is the coagulation here down, and this is the cutting speed. It can cut with high power and with low power, but the coagulation here is less compared with the Holmberg laser, and the blood coagulation almost minimal. So the healing CO2 is beautiful, less scar, or almost you cannot see the scar in oral cavity. And it's very used in skin remission also, and the fractional laser. The most powerful in coagulation is the Holmberg, and it is very, very dangerous in the oral cavity. We have to be careful about lingual nerve, and if you're dealing with surgery in the floor of the mouth, the salivary gland ducts, you might seal the salivary gland ducts if you are not careful, if you're using the Holmberg laser. And this is published in this book, 2001. Can we use the laser in ortho? I think it's well established now that laser can increase the resistance of caries. But what type of laser we can use? We cannot use here the diode, we cannot use the Nd:YAG, we cannot use the Holmberg, we cannot use the KTB. The only wavelength we can use in this purpose is the erbium YAG laser. It's the only wavelength we can apply safely in hard tissue. You can do etching with the laser. You can do you can remove with the laser. This is the thing with you. So let me see. Not working. I'm sorry. There is a problem. Here. This is. I got this from the internet. Actually, it's not my case. I have some cases for caries. So just apply the laser like that, and it will interact with if you just explain why I need to charge my found. Yeah, okay, I'm ready with my storage, so I sorry for this. Okay. Disadvantage of using the Facebook that your reaction would know they are with you or not. Feel I'm okay. Now with the air glazer, it has the it's the best and the safest after the CO4 laser hazard, and the wavelength is 2.94 micron, and it's very safe to use it in the oral cavity for soft tissue because it has no effect on the, or less effect in hemoglobin. So if you do frenectomy, it's more safe than the diode, and you can use it in hard tissue as well. There are Professor Carlos Eduardo in Brazil. He did a study on the effect of the laser on the pulp, and he found that in fact it's by -2 the temperature in the pulp compared with the diode, which increased the pulp by 1.6 degree, and this is an advantage for the air glazer. And we are using also the water of the laser to because it has a photoeffect, so that it will clean also the soft dentin much better. And the laser cut the hard tissue. The air laser, cut the hard tissue with no smear layer if you compare it with the traditional drill. So in this case, the laser can do etching for the dentin and the enamel, and if you combine the acid etch with laser etch, you are going to get a very, very strong bonding of the your filling. Here you can see the microscopic picture for the impact of air beam laser, and the dentinal tubules are very clear. I mentioned the acid resistant a while ago, so it enhanced the enamel surface, as I mentioned, and no smear layer, so it enhanced the strength of bonding agents. And this is a graph where the acid etch only, laser etch only, and combined laser and acid very high. I'm not sure if this is a video. Check. Yeah, no, I think it's a video. This is a case I'm going to do with the air laser to remove the caries here. This patient is sick, and he is a well-educated person, but he cannot really stand sitting in dental chair. So we did the laser for him to remove the caries, and I think we did 5 or 6 teeth without local anesthesia. You can use with the local anesthesia, and you can increase the power, and very safely you can increase the air beam laser power to apply, because it's safe to the pulp. But I cannot do the diode in this direction, directly to the pulp, especially at the cycle third, where the pulp is very near to the surface. I think this is enough for this case. This is removal of crown. Metal-free crowns can be now easily removed with the laser. Only choose debonding, and it's the setup in the machine. Debonding. You choose debonding, and then you apply laser. I might just go fast for the time. So this is a 3-unit bridge. Need to be removed by laser. The patient, she is not happy, I think, about the color or the shade. So the plan was to be removed and to be sent again to the lab after. I think she did this permanent cementation long time ago. So she came with to remove it, and she also cheat the camera can be used, but like damage. I think you understand how difficult sometimes without the laser. And here with the laser it was easily removed, and you could see inside here and very clean, no cement. Cement stick on the teeth. So this is the cement from the surface of the prosthesis, and the laser can easily. Now you could see the cement here. We are trying to remove the cement. For those, they are easily removed with the explorer. You can do it simply, but it's hard. You can remove it with the laser. And you can remove the rest of the cement with the XOR. Now we'll show you just a video how the laser destroy the strength of the cement. This is a this is a crown, and there is a cement. You can see the cement here, and laser, the RBM laser now here. You should not use diode. It's contraindicated to use diode actually. You can see the cement now dissolved and went away easy. So you need to apply laser on all surface. Okay, this is enough. Again, you could use laser is very important also for the soft tissue. I think laser has also an important role in that. For the I think even the CO2 also is very useful. Professor Jim Frame in Birmingham, he did a study to compare the CO2 in wound healing compared with the traditional knife, and he found that there's less fibroblast, and this is scarring the healing for the laser wound. So the use of airmag laser in perio for the root surface is very important. Here you can apply very low of diodes like if you want to see the margins, and very good impression is useful, and you could apply either the erbiumyag laser or the diode in the canal to disinfect the bacteria inside canals. And you also can use Indiag laser, but the erbiumyag laser has one more advantage: photoacoustic effect, which you can find it with the Indiag, as you can see here, the comparison between the erbiumyag laser. You see the tube is jumping with the erbiumyag laser, but if you go to the Indiag laser, there is no photoacoustic effect, and that's the advantage of the erbiumyag to the Indiag and diode. So if you have the erbiumyag laser, the 2.94 wavelength is much better than the diode or Indiag. This is an indicate. We'll go faster just to see the difference. If you combine the chemical agent with laser, it will be much better and give you more disinfection. In soft tissue depigmentation, you could use any type of laser, but of course, if you use the diode, it might go deeper and give you a better result. Although you can use the CO2, you can use the erbiumyag laser because there's not too much bleeding. Could the laser without anesthesia, even in soft tissue. Depigmentation, diode or Indiag are very good tools for treatment of such cases and the gingiva. You have to be parallel to the tooth, try to avoiding directing the laser to the root apex, especially if you have an orthodontic case where the teeth sometimes almost outside of the alveolar bone. I think this is, I don't know. You could use ablation or gingivoplasty to reshape the. You can expose the soft tissue, the impacted canine. I love to use the erbiumyag laser because it's very safe in the tooth itself. Like this case, I did it. This is a 15-year-old boy. Exposed the canine. And I was not worried that the laser will be directed to the pulp because it was an erbiumyag laser and not too much bleeding in this area, so I can control the bleeding even with the local homeostatic agents in this case if it's happened. A phrenectomy with any type of laser is useful, but if you're applying the diode, you have to be parallel to the long axis of the tooth. Never ever direct the laser to the apices of the teeth, except if you are dealing with erbiumyag laser or CO2 laser. Here, the floor of the mouth, we have the lingual frenum, and other structures are the salivary gland ducts, where it is not actually direct, but you have to be careful. You have to consider it in your mind when you're applying the laser here. If you are using CO2 laser, you have to be careful not to touch the teeth because it's harmful to the hard tissue. In this case, you cover the teeth with gauze. You can do fractional. It has the ability to do fractional. Why not? The dentist can use at least down the mouth. You can help the patient by either remove the pigmentation or remove some scars with the laser, which is I think it's worth to do it. And this is the one of the cases with the erbium laser, and you don't need to use any local anesthetic if you are using the erbium laser, and then wipe it and remove it. It might take time, but it's useful for the patient. Hemangioma, this is a beautiful things that we learned from laser, and it was I think laser is a blessing from Almighty God that we can cure patient without any invasive surgery, but applying the fiber with what we call technique, and the patient can be treated in the chair without changing to the structures. And there is a case just last month. He is a consultant family medicine. He has a hemangioma in his tongue. I'm sorry I did not put his photo or video, although he agreed that I can publish it. He went to one of the main referral centers, King Fahd Medical Complex in Riyadh, and they treated him under general anesthesia to do immobilization through his arteries and trying to find a feeder and all this business, but it did not work with him. And one of my friend, maxillofacial surgeon, the patient from Medina, and he asked him to come to Riyadh to visit me in Dubai, where we have the cities that moved him. Told him I'm going to apply laser 5 minutes, and anesthesia, and it takes me just only 5 minutes to cure his hemangioma. You won't see the result immediately, but you give him appointment after 3 weeks or more, and the patient actually was very, very happy about the changes in his oral cavity, and he said, I was not able to get married because this is very huge hemangioma in my mouth. This patient also was treated with laser with less invasive tools, and here you could see the post-operative result. And here, this is a child, 60 days, female, the cleft, and let me see. I think this is video with the bleeding. So, because the child, we did this under GA and interstitial technique, and then we remove this part after. This is the interstitial technique where we go from a normal tissue to avoid bleeding. I should not perforate the hemangioma. This is the treating. I should not perforate. I just apply the laser away and have just my power to treat this case safely. Carcinoma in situ, you can excise with laser, you can send it with a histopathology, and the way you do it, you go around it and then remove the layer you need, and to reduce the scar, you have to play with your power. And as I mentioned before at the beginning of the lecture, retraction is very important to reduce the coagulation zone and to have better healing and less scarring. This is a Professor Bradley technique of removal of a lesion, going around it and then lift it up, and it is a bleeder. You can use a defocusing mode here beyond the focal point. This is the laser, this is the handpiece, the focal point. I go withdraw with my handpiece, and then I apply the laser in defocusing mode for the bleeder to coagulate the blood vessels, and I can send this to the histopathology. I don't think there is any tools in today's in dentistry can give you a very quick and less traumatic to remove any kind of lesion, small or big, can beat laser. Laser is the only tool that you can apply it very easily to remove a small lesion. And if hardly you can see it here, this is immediately post-operative. This is exactly just few seconds after we remove the lesion. And I doubt that with the knife you can do this without suture tearing and without bleeding. So this here, we could say laser is very important today in our daily practice. Lesion like this, if you are going to remove it, you can do this under local anesthesia. I did this under local anesthesia with CO2 laser, and I removed it. I put it in pathology and formalin, and there's no sutures, as you could see. So there is no tethering. The patient can speak fluently without any effect in the tongue movement. And the only tools, or the best tools that can do this, is the laser. And if you use diathermy, you're not going to get the best result if you compare it with the laser. Less damage. The coagulation zone here, you are talking about 50 microns only. And I doubt that you have a tool that can give you this minimum coagulation zone. This lady was in military hospital, and they could not treat her under general anesthesia because of her heart condition. So therefore, to me, a medical place where I was able to remove this under anesthesia with CO2 laser. Here, I should use CO2 because it is fast and we have no much bleeding, and I have to send this also to histology if I need. Other lesions, it can be removed safely with diode or with CO2, whatever. And malformed tongue, you can use the laser, but you have to reduce the power here, and then you can stitch it also. Even if you are using this, you can stitch it. Why I should use laser here? Just to reduce the bleeding, because the posterior third of the tongue has too much blood vessels compared to the anterior. And in this case here, I need just to reduce the bleeding, and also and to keep the tissue, some capillaries where it can help in healing. Implant, you could do implant without anesthesia, as I did in 2009, and we are proud to be the first people in Middle East to this without anesthesia. And actually, it was not my idea. I was a co-chairman in Germany in 2006 in a conference, and the idea was I have to evaluate the German and my colleague, the chairman, to evaluate the foreigners, and I evaluate this man here and this man. But this man, Ingmar, he is the first one, he did implant without local anesthesia. I really, although I using laser since 1993, I was shocked to hear about this one, and I invited him and discussed the protocol and techniques, and I think he did very well actually. So I applied this in Riyadh April 2009 in medical days. On this video, I will show. I think there's a video here. Yeah, this is how Erwin laser with this patient without local anesthesia. The disadvantage is it is slow compared with the traditional tools, but for phobic patients, useful tool for better, faster osseointegration. This is also a nice tool. You can combine the drill and to finish it with the airmag laser to get better healing. This is also useful, and because you can use the laser with the crystal tip here, you can use the insert inside. The only disadvantage here that some companies don't have long tools. So this is, I think the maximum is 12 millimeter, and this is one of the disadvantage for using the airway laser as a drill. Not sure what is this. Here, yes, this is the same procedure, I think. We're going deeper here after the tissue, and then Yeah, that's the same. And less bleeding. Almost you don't see too much bleeding by using the laser, and no damage to the tissue. So I can apply my implant with less trauma to the bone. Okay. Applying laser as endodontic, also you are not only cutting or you are killing bacteria also. So we have sterile wounds, whether in implant or also in malignancy or lesions. But I should give patient antibiotic to avoid any infection post-operative as a routine. There are now today's tools for the implant. This is the air beam laser, where the laser can come in 90-degree to the surface of the implant. If you apply the tips of the vertically implants, and this act. So the laser comes from the side of the and this is a beautiful thing that you can treat the space of the implant, and laser is the best for peri-implantitis, and there's no doubt that it has the effect on this one. Look at here. Also for the root surface, air mag is one of the best tools to treat. And now we are introducing to dentists a new aspect of treatment that they can knowing better than any doctor in the medical or the field. Of course, they are dentists in medical. By a low level interaction using air beam laser. For instance, you apply the laser like this one. I had one patient. He is very actually. He came to me very disappointed with his condition, and he said, "I really have a difficulty with the people surrounding at home, and I snore very loudly." I told him, "Look, we will try with you laser." And the first time we did the laser for him, in the first 3 days, he said, "I almost actually get benefit a 70% reduction in the snoring." And we do usually give 3 sessions. And this is from the first session, and the second one will be after 2 weeks. Then the third one will be after 1 month. So we can use the level laser for snoring and also for treating of lesions in the oral cavity. Well, we mentioned the main advantage for the laser, and of course there are disadvantages for the laser, and I think machines are very expensive. Like in Nucleus, we have many machines almost cost more than 2 million just for laser machines, and the cost is really high. Lots of tactile. I disagree with this actually. During surgery, I would feel that I'm happy by using laser, even a CO2 laser without touching. Really, I feel I'm enjoying what I'm doing. I have just did this yesterday. I advertised this in my but I was able to do it. Permission from patient. I might do it later in Twitter or in my channel in YouTube to see how beautiful using the CO2 laser. The main disadvantage is cost. Second, goggles. I have to change goggles from one wavelength to another. This is actually very bad things to do in dentistry, and I have to wait for the goggles and to get help for somebody if you are scared to put your goggles, and I have to switch on the machine and plug it in, and then I might ask for another machine to plug it in. I hope in future that we wish to have one machine and give me all type of wavelengths. So I just one button, like what I have there. Maybe it has ND and MIAG, but it doesn't have a diode or CO2. So still we are looking for the day that we can buy one machine, a very cheap machine, can give me all type of wavelengths. And the high level laser, we consider it a class 4, very dangerous laser if applied incorrectly. I mean, it is safe if you apply it safely. And is laser dangerous? No, it is not dangerous. I would say the knife is dangerous if you apply it in an incorrect way. So if you're using a knife, you have to be careful just only to cut the area of interest. Same thing, the laser. You should direct the laser to the target, but in addition to that, you should know the type of laser and the power and energy density you are using. This is very important to avoid damage. And to buy a machine, this is not enough. You have to learn more about laser physics. I have seen cases where the companies are selling machines, they are getting wrong. This is representative, actually, they are calling damaging, especially if they are dentists and they are not aware of laser and just selling laser, and they have seen cases like that. So we have to be careful about this type of laser. But airbag laser is very safe. Even the CO2 laser, I could use the CO2 laser even without goggles. It's very safe, but I should not direct it to my skin or to my eye. I have to direct it only with the lesion. And we have to use a special room. You have to lock the door when you're using. You have to have safety measures because if you are protecting yourself and your nurse and probably your patient, but you should protect the others are using other clinics, or they can come to your clinic from time to time during your procedure. So there are some precautions we have to use it. Other goggles you can use to protect the eyes if you are using infrared laser. And I actually went to a company. I said to them, "Oh dear, I need to give me one goggles that I can use for all type of laser." And they gave me goggles made of metal. I said, "I cannot see anything. They said this is the best." So I wish you find a goggle that help you protecting you from all type of laser wavelengths. And this is a very important care. If you need to apply by laser, you have to understand the laser wavelength and absorption curve. And this is the end of it. Thank you so much. First time to use live in Facebook, and I don't know how to finish it. Oh, there's a finish button. Shall I push the Dr. Mazen? Shall I push finish, or there is a question? What I should do now? I don't know what I should do. This is the disadvantage of I cannot hear you. I think I should finish and press the button of finishing. Okay, thank you.